Hi guys! Imagine coming across a car accident and you're the first on scene. Do you know the basic life-saving skills needed if someone's unconscious or bleeding? My name is Shara, and tonight I'm going to inform you on the importance of CPR and knowing the new priorities in which to conduct CPR, along with recognizing bleeding, how to treat for the hemorrhage, and lastly, the importance of shock treatment. In the military, we learn the basic first aid skills to treat and care for each other, primarily in a deployed location. But not only is it vital to us, it's vital to everyone, because life-threatening situations can occur anywhere at any time. According to the American Heart Association, CPR was first founded in 1740, and over the years, we have conducted CPR as airway, breathing, and circulation. But now, the new priorities are circulation, airway, and breathing. They found that starting the compressions first helps provide blood to both the heart and the brain, which is vital, and it has a higher survival rate. Once you have the heart pumping, it is important to maintain the airway. After you have the airway open and clear, then you can start your breathing. Now, knowing the new priorities and why it is so important to conduct CPR, I'm going to talk to you about bleeding. There are two primary types of bleeding. You have your internal, which consists of bruising, swelling, lightheadedness, dizziness, and abdominal pain, depending on where the internal bleeding is. Then you have external. There are three different forms of external bleeding. You have your capillary bleeding, which is pretty much a bright red, slow type of bleeding. You can see that in any type of paper cuts or any other type of superficial cut. Also, you have your venous bleeding, which is a deeper red, slower, or sometimes fast depending on the type of laceration you have. Primarily, you see this type of blood when they're drawing your blood. Lastly, and the most dangerous type of bleeding is your arterial bleeding. This would typically be a bright red spurting type of bleeding. Again, this is the most dangerous type of bleeding. In order to control bleeding, you have 4 primary steps, and they consist of applying direct pressure to the wound. If it's still bleeding at that time, you want to elevate where the wound is. If it's still bleeding, you want to apply pressure to the primary artery located closest to that wound. Lastly, if the bleeding is still continuing, you want to apply a tourniquet. Again, that is the last resort in order to stop the bleeding. Now, knowing the different type of bleedings, you want to learn how to treat for a life-threatening situation. And with this, I mean shock. According to the National Institute of Health, shock is described as a shortage of oxygen in blood to the major organs and tissues. And according to emttraining.org, there are simple steps in treating for shock, such as elevating the leg 8 to 10, 12 inches. And to cover the body, you want to keep the body warm, especially the core, because that's where all your organs are. When doing this, you can help prevent someone from going into neurological shock, septic shock, or even cardiogenic shock. Knowing how to treat for shock is one of the last but most vital steps in saving a life. Now that I've kind of described to you the different type of shocks and how to treat for it, let's go ahead and cover everything that we've learned. We've learned the importance of CPR and the different priorities for it. We've also learned the different type of bleedings, such as internal, external, and the 3 types of external bleedings. We've learned how to control bleeding, and then we learned how to treat for shock. I hope that you have enjoyed this speech. Thank you.